It was written here only hypertensive crisis. Now, sulfonamide is a new MAO inhibitor. Sulfonamide, Gilene thiazmethyl, selegiline, and racegiline, but sulfonamide is another MAO inhibitor. It is used for L-dopa carbidopine. Used with L-dopa carbidopine patient with Parkinson experiencing the off episodes. So off episodes are basically the episodes in Parkinsonian patients, in which all the symptoms like no drug is given. If full blown symptoms of the Parkinsonism there appear. Now, dopamine agonist. Increasing dopamine level at the synapse. Dopamine agonists are there. Just a second. Okay, so dopamine agonist. They obviously act on the D2 receptors, and they can be used in monotherapy in Parkinsonism. It's the time elapsed. Okay, ठीक है. These are drugs activated D2 receptors can be used as monotherapy in one. So ergot derivative. Dopamine is there. Ergot derivative, including bromocriptine and pergolide. These drugs are short acting and can cause digital vasospasm. Whoa. Leading to gangrene, obviously. Something that is causing digital vasospasm got to be gangrenous. Erythromelalgia. Okay, Google. What is erythromelalgia? Episodes of burning pain and redness in the feet and sometimes the hands. Okay. So it's a rare condition, first of all. Burning, pain in feet, and redness also. Hand, legs, arms, and ear. So that is erythromelalgia. So these drugs can also result in pleural, peritoneal, and cardiac fibrosis also. Ergot derived dopamine agonist, bromocriptine and pergolide, peritoneal and cardiac fibrosis. So ergot alkaloids require slow upward titration of doses, and the long-term use of the pergolide is associated with cardiac valvular defects. So if you're using pergolide for a long time, then there'll be cardiac valvular defects. These drugs are really strong. There are new non-ergot dopamine agonists. These are pramipexole and ropinirole. Pramipexole and ropinirole. Ropinirole. So these do not have limitation, like these are long acting and they do not cause digital vasospasm and hence gangrene. These are now the first choice of drug in Parkinsonism, preferred over L-dopa. Non-ergot, pramipexole and ropinirole. These are the newer drugs that are like breakthrough in the Parkinsonian defects. Now ropinirole, it has been approved for restless leg syndrome also. Restless leg syndrome, it's a condition. Pramipexole is excreted mainly by the kidney, whereas ropinirole is metabolized by liver. Rare but important adverse effect of these drugs is excessive daytime sleepiness. And recently dopamine agonists have been associated with, is it associated or associated, let me know, with impulse control disorder. Like, oh my god, recently dopamine agonists have been associated with uh, impulse control disorders also. Nice. It just means that if we are taking dopamine agonists like these no non-alcoholic derivative and all, they're usually responsible pathological gambling, like impulse, hypersexuality also. Like these are the drugs that like in the loss of inhibition, the inhibitions are lowered and your you're very impulsive, you just want to do the things you want. There are no inhibiting factors, you'll not like judge properly. So these are the adverse effects. These can be adverse effect of dopamine agonist and rotigotine. Oh my god, this is like, yeah. Now rotigotine is a dopamine agonist that can be administered through a transdermal patch. Rotigotine, transdermal patches, but was discontinued due to crystal formation on the patches. Okay. The rotigotine is also a dopamine agonist. It's placed transdermally, बस वहाँ पे crystal formation हो जाते थे, crystal formation on the patches, so हमने उनको discontinue कर दिया. Now apomorphine also is given subcutaneously. Subcutaneously is given for temporary relief of off periods, troublesome nausea. There, I don't even know what troublesome nausea means. Could have written just nausea. What the fuck is troublesome nausea? Troublesome nausea. Seriously. Just nausea could be written, right? Maybe like pain, more pain and all, more of the GERD and all, temporary relief of off periods. So off periods is, there is temporary leave, but off periods is basically the Parkinsonism state where there is full blown symptoms of Parkinsonism, and it seems like there's no treatment is given, but treatment is being given. That is known as off period. Now drugs that increase the dopamine level at synapse. So synapse में we are increasing dopamine level at the synapse, we are increasing. So what we want to do is we want to pramipexole, ropinirole. These are the newer drugs like dopamine agonist and all, no? pramipexole क्या था वहाँ पे, ropinirole क्या था वहाँ पे, bromocriptine क्या था वहाँ पे, and pergolide also. So these four were क्या था ना टेबल पे, that blood brain barrier वाला. Let me show you guys this one. Cute. So ropinirole improve restless leg syndrome, excessive daytime sleepiness, obviously this impulse control disorders, and pramipexole is actually the first. They are actually excreted mainly by kidney, by liver. Fine. That okay. Now amantadine. These are not given there. So amantadine is actually antiviral drug. Yeah, it is antiviral drug, and also like uh, I remember it from the House MD episode where cutthroat bitch, what was her name? Amber. Yeah, Amber. She was taking amantadine for the flu, and he mentioned that it binds to the protein, and hence, since her kidneys were damaged, it is because of the amantadine something happened and she died. Yeah. It increases synaptic dopamine level by increasing presynaptic release, and so there is increased synaptic dopamine level by increasing the presynaptic release, and also it decreases uptake. It also possesses anticholinergic and anti-glutaminergic blocking. Yeah, that is also needed. We have to decrease the anticholinergic, cholinergic. We actually have to do what? We have to increase the presynaptic dopamine. We have to decrease also something, right? Mm-mm-mm. We have to decrease the cholinergic activity, so it possesses the anticholinergic and anti-glutaminergic, so it's good. Adverse effect of this is nausea is there, insomnia is there, ankle edema is there, and libido reticularis. So if comes libido reticularis, that is my amantadine. But they should have shown, like in the episode, this wasn't shown. It should have been shown. It is indicated by treatment of dyskinesia associated with chronic levotopatherapy. So in dyskinesia, carbidopa is not helping abnormal coriform movements. Only carbidopa is only helping with postural hypertension, arrhythmia, and vomiting symptoms. Are we still on? Yes, we're still on Parkinsonism. 1, 2, 3. 1, 2, 3. 1, 2, 3, 4. It's a huge chapter. Now, drugs that inhibit the brain cholinergic transmission is okay. Drugs that act by blocking the D2 receptor in the brain. Like antipsychotics and metoclopramide. उसमें बोला था domperidone acts more, but the metoclopramide also has like D2 receptor action, like D2 antagonist action, but dopamine उसमें लिखा था. Let me find it. D2. कहाँ गया यार? Less hangover. There was, I remember. There was Zolpidem and Zappler. ये तो ओमेगा रिसेप्टर्स पे काम कर रहे हैं, और एक्सन इज एक्चुअली वीकफुलनेस के लिए होता है, और एक्सन फॉर वीकफुलनेस. ओके, I clearly remember there was one. And metabolized by CYP18 metabol. ठीक है, रामिल्टॉन है ना, रामिल्टियन यहीं पे है. हाँ, CTs and domperidone but not metoclopramide can be used for the treatment of this vomiting. Seriously man, तो इसमें क्या हो रहा है कि nausea and vomiting तो इसमें होता है. डोपामिन रिसेप्टर अगर यहाँ पे आ गया तो पेरिफेरली फॉर्म हो रहा तो, बट इसमें लिखा था डोमपेरिडोन बट नॉट मेटाक्लोप्रामाइड. और ऑल्सो इसमें लिखा था कि दिल भी ऑब्वियसली भी, बट यही लिखा था उसमें. Drugs that act by D2 receptor blocking can cause Parkinsonism. In this conditioning, that is why metoclopramide is not given, because it blocks the D2 receptor, or domperidone I guess acts on 5-HT4 receptor. तो मैंने गलत बोल दिया था गलती से. In this condition, increasing dopamine level is not effective because the receptor on which it has to act as D2 are already occupied. So therefore, anticholinergics are preferred. Okay. So standard anticholinergic like trihexyphenidyl and anticholinergics, no, procyclidine, benzotropine, or phenadrine, biparidine. These are drugs of choice for drug-induced Parkinsonism. First generation antihistamine with high antimuscarinic activity like promethazine and diphenhydramine. Oh my gosh, you know I'm on diphenhydramine because it was given to me with codeine because I had cough, and it's gone now with 2 doses, but I felt so drowsy, and still my head is aching. Can also be used for this indication. So they are antihistaminics with high antimuscarinic activity also. So obviously they are anticholinergics. That's what gave me migraine. Adverse effect of antimuscarinic activity includes urinary retention. Oh yes, blurred. ये हुआ मेरे को. Blurred vision was there. Shit, now I see clearly. My whole room was so blurred when I was on diphenhydramine. My god. Constipation तो नहीं, डायरिया और ऊपर से हो गया था. Actually codeine and diphenhydramine, they're supposed to cause constipation individually. Even individually they have adverse effect of causing constipation, but I ended up having diarrhea. I don't know why. Now other neurodegenerative diseases, these are Alzheimer's disease. Obviously Alzheimer's में dementia होता है, senile dementia, that is due to the deposition of amyloid plaques. True. In the hippocampus. Okay, hippocampus is the one region that converts short memory to long-term memory. So if there are amyloid deposition in hippocampus, dementia has to be there. So there is loss of cholinergic neurons in the brain, and anticholinesterase can cause that can cross the blood-brain barrier or mainstay of treatment. So anticholinesterase. So so we are actually the enzyme which is supposed to degrade the choline acetylcholine. We have to give the inhibitors of those drugs. So we are actually increasing the acetylcholine activity, ACH activity. Now Tacrin was previously, but its use has been declined due to its hepatotoxic. Tolcapine also is hepatotoxic, right? Liver toxicity, yeah. Potential and needs the frequent dosing also. Tacrin में. Now donepezil, rivastigmine, and galantamine. Donepezil, rivastigmine, and galantamine. They are fewer and newer anticholinesterase inhibitor useful in Alzheimer's. May rivastigmine, so I think I remember. They're less toxic than Tacrin also. Donepezil can be administered once daily and off. So जो frequent dosing वाला था वो भी scene खत्म हो गया with donepezil, and offering an advantage over other cholinesterase. And rivastigmine is approved for treatment of dementia due to Alzheimer's. That's why I have heard of it. As well as Parkinson, yeah, right. Acetyl L-carnitine has antioxidant property. Apart from increasing cholinergic transmission, it shows promise in decreasing the symptoms and showing the progression of ED. So acetyl L-carnitine, memantine, galantamine. Memantine is an non-MDA antagonist approved by FDA for treatment of advanced ED in combination with cholinesterase inhibitor. So we are actually giving this is not this, I know what it is, just forgot the name of it, but I know what it is. There was this thing and that thing. Yes, so this was here, I guess. I remember reading just here, पता नहीं कहाँ है, किसी की स्टार्टिंग में ही था कि किसी की तो स्टार्टिंग में ही था. Am I gonna get that? just here पता नहीं कहाँ है पढ़ा मैंने, इसमें ही मैं गुम हो गई, भूल ही गई मैं. वाह, great. Let me search in the ये रहा. नहीं तो बिल्कुल भी नहीं है, अभी तो पढ़ा था. सीरियसली अभी पढ़ा था. हाँ, अभी यहीं पे पढ़ा था. ड्रग्स इनहिबिटिंग ड्रग्स इंक्रीजिंग डोपामीन लेवल. हाँ तो यहीं पे पढ़ा था ना, कहाँ क्या, ये तो है. एंटी पोजेसेस anticholinergic and anti-glutaminergic is NMDA blocking. anti so anti glutaminergic. So yeah, anticholinergic and anti-glutaminergic blocking activity. तो ये तो है ही anti-glutaminergic, so it is given with cholinesterase inhibitors. Now Huntington's chorea is due to loss of the GABAergic neurons in the striatum that leads to loss of GABAergic neurons. They lead to dopaminergic. यहाँ पे ओवर एक्टिविटी हो रही है हंटिंगटन कोरिया में. Opposite to Parkinsonism, thus T2 blockers like chlorpromazine, haloperidol, as well as olanzapine, they are useful in the treatment of this disease. Okay, tetrabenazine, it's dopamine depleter. It's a drug of choice for this indication. And deutetrabenazine, tetrabenazine, and deutetrabenazine. 4 and 2 is a new vesicular monoamine transporter 2, which is VMAT. They were inhibitors because they had to convert because of excess ये हो रहा है, excess dopamine production हो रहा है, so we have to actually increase the monoamine activity. So vesicular monoamine transporter 2 deutetrabenazine and tetrabenazine. So it's actually opposite. Recipe. This is also, it can also be used for Huntington's chorea also. हैं तो उसी के लिए तो कर रहे थे. D2 blockers like chlorpromazine, haloperidol, ये सब देते हैं ना. These has to be given, and this is olanzapine. कार्बोनिज़ापीन क्या एंटागोनिस्ट है ना. नहीं, बीटा कार्बोलिन था. मैंने कहाँ पढ़ा. क्लोप्रोमाज़ीन वो है क्या. GPRS सेल फोन. लेट मी सी. नहीं, कार्बोनिज़ापीन है. सी ये क्या है. क्लोरप्रोमाज़ीन. नो, olanzapine. ठीक है. Reserpine also acts by depleting the central monoamines. They're decreasing it. Okay.